Welcome to the deep dive. Today we're diving into a really important area, pediatric palliative care. Just try to imagine the huge challenge for parents facing incredibly complex medical decisions for their child, child with a life-limiting condition. That's where something called an individual care plan, or ICP, should really be their main support. But well, what if it's not quite working as intended?
Exactly. And this deep dive looks into a mixed method study from the Netherlands. It explores how parents and healthcare professionals actually experience these crucial care plans. Our goal here is to pull out what makes an ICP genuinely helpful, but maybe more importantly, where it needs to change to better serve families and caregivers right when they need that support most.
Okay, so as you were digging into this study,
Right.
what was the kind of the first big thing that jumped out about how people see these ICPs?
Well, what stood out right away is that, yes, everyone agrees the ICP is important. That's clear. But the research strongly signals that actually significant changes are needed, especially around how easy they are to use day to day. The study involved 27 parents and 161 healthcare professionals. And for both groups, Chapter 4, the section on needs, wishes, and goals was seen as the most critical part. It's really the core of the plan.
Right, the heart of it. And what really struck me from the parent side was this wish for Chapter 4 to capture more of like the essence of their child. They wanted it to reflect who their child is, not just the medical details. Things like how best to communicate with them, how to tell if they're comfortable. It's about their unique personality, isn't it? Moving beyond just the medical chart to the actual person.
Precisely. It's that human story element. And then connecting that to the bigger picture, healthcare professionals also valued that chapter, but wanted it expanded. They were looking to include more on advanced care planning outcomes, so clear decisions and steps for future care scenarios, thinking ahead, basically.
Okay. And beside that really personal aspect, was there anything else, maybe more practical, that everyone found helpful?
Yes, definitely. The overview of the care team and all the contact details in Chapter 2 that was flagged by pretty much everyone as incredibly useful. It just helps collaboration between all the different people involved. You know exactly who's part of the team.
That makes sense. Knowing who to call when. So the plan was generally seen as complete, but were there specific things people felt were missing?
Yeah, while generally complete, there were specific gaps mentioned. Healthcare professionals, for instance, brought up wanting a dedicated chapter or section on palliative sedation. It's a very specific intervention, using medication to reduce consciousness for unbearable suffering. They felt clearer guidance was needed for everyone involved in care.
In parents. What were their thoughts on missing content?
Parents often wanted more detail on end-of-life care generally, and also more specific information related to the disease or the palliative care itself. Things like understanding the cessation of feeding during palliative sedation. They needed that information to really grasp what was happening during such a difficult, critical time. Oh, and primary care professionals. They also mentioned wanting an overview of what resources and materials were actually available in the child's home. Just practical stuff for daily care.
Okay, so we have these key insights on what should be in the ICP.
Yeah.
But then there's the massive practical question. How usable are these plans day to day? The study found that even though the content might be mostly there, the ICP itself was often described as very long and, crucially, not user-friendly. Both groups said this. You can just imagine trying to find vital info quickly in an emergency. Sounds like a real struggle.
It is. And they also pointed out the language, often too formal or filled with medical jargon. They asked for simpler terms. Plus, the structure sometimes felt illogical. And a really big one. Keeping the physical paper ICP up to date. That was a major headache. Especially with things like medication changes happening all the time. There's a real danger there of using outdated information.
Right. So you've got these problems. It's too long. The language is tough. It's hard to update. Did the study point towards a solution, a way forward?
Yes, absolutely. There was a strong consensus around making the ICP available in a secure digital environment. Going digital would tackle the length issue, make updates almost instantaneous, and just massively improve accessibility for everyone on the care team and the family, too, making sure everyone has the latest, correct information easily available.
So when you boil it all down, this deep dive really shows that an effective ICP isn't just one thing. It's this unique mix, isn't it? It's part personal story, the child's values and preferences, and part critical medical guide.
Exactly. But its real power, its full potential, isn't just unlocked by being comprehensive. It needs to be genuinely user-friendly, accessible, understandable, especially when time is critical.
Which brings us to a final thought for you, our listeners. How could these insights, about personalization, easy digital access, clear communication. How might they apply or transform other complex care planning situations, maybe even beyond pediatrics?
Something to think about. We really hope this deep dive has given you a useful shortcut to understanding more about this vital area.
Thanks so much for joining us.